Hello, I'm Dr. E. Barry Gordon, and this is the 18th video in my series on testosterone deficiency and the second and concluding video on type 2 diabetes. In the previous video, I explained the nature of type 2 diabetes and that testosterone deficiency is a basic integral part of it. I gave my opinion that when it comes to caring for this disease, we live in an era of gross medical neglect because while it is probable that almost every type 2 diabetic is deficient in testosterone, this hormone deficiency is rarely even looked for by the medical community, much less treated. In this video, you're going to hear some of the abundant research that has been published on this relationship. And there are several things to keep in mind as you listen to the results of these studies. Remember that type 2 diabetes or insulin resistance is included in what is called the metabolic syndrome, a group of diseases that are commonly seen together. They include high blood pressure, triglyceride and cholesterol abnormalities, and abdominal obesity. Because of the very common association, many in the medical world make the assumption that all people with the metabolic syndrome also have cardiovascular disease. Remember what I have pointed out several times before. Testosterone deficiency has always been severely underdiagnosed and undertreated. So the findings of all clinical studies on testosterone must be viewed with the suspicion that the effects of testosterone deficiency or testosterone replacement were greatly underestimated. One of the studies that you are going to hear today gives major support to that view. Remember that if you have type 2 diabetes, your testosterone level has in all likelihood never been checked. If you have friends or relatives with type 2 diabetes, it is highly unlikely that anyone has ever checked their testosterone levels either. Finally, much of the language in these studies is technical. So in order to help everyone understand what these researchers are saying, I will substitute simpler words or phrases where appropriate. The unaltered abstracts are on my website, www.thehiddendisease.com. This was the conclusion of a study from Finland published in the journal Diabetes Care in May 2004. Quote, "Low total testosterone levels independently predict development of the metabolic syndrome and diabetes in middle-aged men. Thus, testosterone deficiency is an early marker for disturbances in insulin and glucose metabolism that may progress to the metabolic syndrome or frank diabetes and may contribute to their development." Close quote. This study was done in the Netherlands and was published in the May 2005 issue of the Journal of Clinical Endocrinology and Metabolism. It was titled Endogenous Sex Hormones and Metabolic Syndrome in Aging Men. Endogenous means produced in the body. This study looked at the same issue as the previous study, but from the opposite perspective. Quote, higher testosterone levels in aging males are independently associated with a higher insulin sensitivity and a reduced risk of the metabolic syndrome, independent of insulin levels and body composition measurements, suggesting that testosterone may protect against the development of the metabolic syndrome. Close quote. If testosterone protects against the development of the metabolic syndrome, it must protect against the development of diabetes and cardiovascular disease as well. The Journal of Clinical Oncology published this study from Johns Hopkins in August of 2006. The study looked at what happens to men who underwent androgen deprivation therapy, that's severe testosterone depletion, as part of their treatment for prostate cancer. You'll recall that I've twice discussed a 2008 study from Harvard that showed that men treated this way had a 20% increase in their death rate. Quote, these data suggest that metabolic syndrome was present in more than 50% of the men undergoing long-term testosterone deprivation, predisposing them to higher cardiovascular risk. Abdominal obesity and higher blood sugars were responsible for this higher prevalence. We recommend prospective studies to further delineate this association." Close quote. A United Kingdom study on the effect of testosterone replacement on diabetes was published in the June 2006 issue of the European Journal of Endocrinology. Quote, "Testosterone replacement therapy reduces insulin resistance and improves sugar control in testosterone-deficient men with type 2 diabetes. Improvements in sugar control, insulin resistance, cholesterol, and abdominal fat together represent an overall reduction in cardiovascular risk." Close quote. They found that testosterone replacement reduces the risk of a diabetic getting heart disease. Are you keeping in mind that it is a rare doctor who ever checks diabetic patients for testosterone deficiency? Another Johns Hopkins study on this subject was published in February 2007 issue of Diabetes Care. This was the result of a National Health and Nutrition survey. Quote, "Low free testosterone concentrations in the normal range were associated with diabetes, independent of obesity. These data suggest that low androgen levels may be a risk factor for diabetes in men." Let me repeat that first part. Low free testosterone concentrations in the normal range were associated with diabetes. Close quote. This is the study that clearly supports my contention in video 6 that current laboratory reference ranges cannot be relied upon to diagnose testosterone deficiency. If low normal testosterone levels are associated with diabetes, then obviously these low normal values are insufficient for good health. An enormous number of people whose testosterone values fall within current laboratory reference ranges do not have an adequate amount of the hormone to be healthy. Here's another opinion on replacing testosterone. This one from the United Kingdom. It was published in the February 2007 issue of the International Journal of Clinical Practice. Quote, quote, "Men with the metabolic syndrome and symptoms of testosterone deficiency may be managed by, in the absence of contraindications, testosterone replacement therapy, along with weight reduction and other measures to normalize glucose, lipid, and blood pressure control." Close quote. They also stated that testosterone deficiency was, quote, "a potentially common and underdiagnosed condition in men." Close quote. Testosterone deficiency may be associated with more than just getting type 2 diabetes. This study on females came out of the University of Arizona and was published in the March 2007 issue of the American Journal of Physiology. Quote, "Changes in the estrogen-testosterone balance at menopause may negatively influence the development of diabetic kidney disease. Furthermore, recent studies suggest that changes in hormone levels during perimenopause may influence disease development." The University of Arizona is saying that testosterone replacement may prevent or delay the #1 cause of kidney disease in the United States, and no one is paying attention. Here's more on the association of testosterone deficiency with the metabolic syndrome and the effects of testosterone replacement. A November 2007 study from Beth Israel Hospital in Boston. Quote, "Low serum testosterone level has emerged as a reliable prognosticator of the metabolic syndrome in men. 1/3 of men with type 2 diabetes mellitus are now recognized as testosterone deficient. Emerging evidence suggests that testosterone therapy may be able to reverse some aspects of the metabolic syndrome." Close quote. if they had used adequate ranges of testosterone to make a diagnosis of testosterone deficiency instead of normal ranges, I believe they would have found that almost all men with type 2 diabetes have testosterone deficiency. And finally, yet another study out of Johns Hopkins, this one in June 2007 on treatment. Quote, "The relationship between diabetes, the metabolic syndrome, and testosterone deficiency is complex. Testosterone supplementation by either oral or intramuscular routes and through exogenous or endogenous delivery has a promising role in this population, although further clinical trials are needed." Close quote. What we have is a flood of studies from major research institutions, all confirming a causative or aggravating connection between testosterone deficiency and type 2 diabetes. I don't know to what degree testosterone replacement will benefit the millions of us who have type 2 diabetes. I have no way of knowing the effects of testosterone replacement on the many long-term complications of diabetes, such as blocked arteries in the heart, in the brain, in the legs, or the vision loss and blindness brought on by diabetic eye disease, or the slow destruction of the kidneys by those with that complication. But I do know two things. Given the current medical neglect of testosterone deficiency and testosterone replacement, very few, if any of us, with type 2 diabetes will be alive when that information finally becomes available. And there is absolutely no reason to not treat all of us with type 2 diabetes with testosterone replacement right now. After being available by prescription for over a half-century, there is no known downside. Remember, testosterone is approved by the Federal Drug Administration to treat any symptom of deficiency. So go to your doctor and demand to be tested for and treated for testosterone deficiency. It's your health on the line. Don't take no for an answer. Earlier videos in this series, as well as the abstracts of all these studies and over 6 dozen more, are viewable on my website, www.thehiddendisease.com. My next video will deal with vascular diseases in men, and the following with vascular diseases in women. Please help me make sure that everyone with type 2 diabetes has the opportunity to learn about the existence of this disease and its relation to diabetes. Talk about it, tell people about it, email the video links, become an advocate for better health. I'm Dr. E. Barry Gordon. Thank you for watching.